Pregnant with fibroids. I previously did a video about fibroids, and the most common question here is whether can I get pregnant while I have fibroids? Can I carry this pregnancy to term? What are the possible outcomes if I get pregnant with fibroids? Welcome back to the Nursing Moms. I'm Nurse Janet, and in this video here today, let's talk about what to expect while you are pregnant with fibroids. And the first question of whether you can get pregnant while you are having fibroids, the answer is yes, but again, it depends. So many women who have fibroids have later conceived and had a safe and a healthy pregnancy to term. But again, these things determines whether you can get pregnant with fibroids. First is the size of the fibroids, if at all it's big or small size, the location, and the numbers. Actually, I told you can have multiple or single fibroid. Some percentage of women, that is about 5 to 10% of women suffering from infertility, always have this history of fibroids. And again, for those women who have the submucosal type of fibroids, it's quite very impossible for them to conceive, because first, this fibroid will be bulging to the uterine cavity, the space where the baby is supposed to grow. So the outcome of whether this conception can grow to term is always very minimal. If the size of the fibroids are big, they can block the fallopian tubes, making it very difficult for the egg to travel downwards or even the sperms to travel and meet an egg. So conception is very unlikely if you have a big size of uterine fibroids. Uterine fibroids interfere with fertility in the following ways. The first thing is that they block the fallopian tubes. They also change the shape of the uterus. These will interfere with the movement of the sperms and an egg. They also prevent the blood flow to the uterine cavity, actually, because they too use a lot of blood. And lastly, if at all they are much on the lower side of the cervix, then they will prevent even the sperms entering into the cervix and swimming up to meet an egg. This is how uterine fibroids can impact negatively on fertility. Again, if they are small in size or they are not located in a way that can really interfere with either implantation or even fertilization, then luckily you will conceive, but this is what to expect after conception. First, the severity of pain. Actually, remember, uterine fibroids also have some pain. During pregnancy, you will realize that you have that lower abdominal pain. These are just typical symptoms of uterine fibroids. You can also experience spotting or even bleeding, especially in the early trimester. And again, a woman pregnant and has uterine fibroids has more chances of miscarriage compared to a woman pregnant without fibroids. Yeah, remember, if at all you had the submucosal uterine fibroids, the one that bulges to the uterine cavity, then there is high chances that implantation won't take place in the right place. And this can lead to ectopic pregnancy, which will lead to miscarriage. Actually, an ectopic pregnancy can never survive. Uterine fibroids can also lead to malpositions and malpresentations for the obvious reason that they will be occupying some part of the uterine cavity. So there'll be very little space for the baby to move and to position correctly the way it should be for a normal pregnancy. Preterm labor is another complication to expect if you are pregnant with uterine fibroids. Reason being, the uterus will keep on enlarging because the uterine fibroid is actually also growing and the baby is growing. So when the uterus is overstretched to a certain limit, then the most likely thing to happen is that you will go into labor prematurely. Preterm premature rupture of membranes. This is another complication that can happen if you are pregnant with uterine fibroids. The reason being the overdistension of the uterus. So there is high chances of the membranes rupturing before time. Obstructed labor. Actually, with uterine fibroids, and especially on the larger size, those large masses of uterine fibroids, there is high chances of obstruction, and this kind of labor doesn't end up normally. This is why most of these people end up having cesarean section. We also have a complication that we call placenta abruption. This is the detachment of the placenta from the uterine wall before term. This always occurs due to the reason that the uterus is over-distended too. Pain, actually due to the degeneration of the fibroids, there will be severe pain, especially the lower abdominal pain, the pelvic pressure. And lastly, the most preferred mode of delivery if you have uterine fibroids is cesarean section. Yeah, you will end up having cesarean section for the reasons that I've said previously, like malpresentation, obstructed labor, and all that. So you have to prepare yourself for a cesarean section. The treatment of uterine fibroids during pregnancy is actually symptomatic. If it's pain, then it will be managed. If at all it's anemia, then they'll manage anemia. Actually, uterine fibroids can predispose you to anemia. However, there is no surgical intervention that can be done during pregnancy, and the pregnancy will carry on normally, safely, and healthy to term. You only need to walk very close to your doctor. Anything that you'll experience during this journey, you only need to notify your doctor. Keep on checking, have enough rest, stay hydrated. Thank you. Thank you for watching, and if you find this video useful or helpful in a way, subscribe, you can share, you can like, whichever the way you will try to show some love. Thank you.